By 2016, Uganda was ranked as having the world's highest incidence of malaria with a rate of 478 cases per 1,000 people every year. Malaria is a major public health problem associated with low socio-economic development and poverty, and it is the most frequently reported disease at both public and private health facilities in Uganda. According to the Health Ministry, a significant percentage of malaria deaths occur at home, and they are not reported by the facility-based health management information system. Statistics further show that 27 out of every 100 deaths of children under 5 years in hospital are due to malaria. It's against this background that the Matibabu team decided to come up with a cost-effective method of testing for malaria, which did not put people at risk of contracting more serious infections from the instruments used to draw blood.
Because we all had had different episodes of malaria, and we knew that diagnosis for the disease is kind of tricky, it takes a long time, we said let's give this a shot.
Brian Jeter, the team leader, says they have gone through 5 generations of developing what is now the world's first non-invasive malaria testing kit.
A lot of prototypes have been manufactured, actually 5 different generations of prototypes, mainly aiming at shining light, both the first 2 prototypes. And the results at this time are not very conclusive.
Matibabu is a Kiswahili word for treatment, and the kit was initially made up of a small finger clamp featuring an infrared light sensor which transfers data to a plugged-in smartphone.
With the non-invasive technology, we are basically using light. We know at a certain level of wavelength of light, between 650 nanometers to around 690 nanometers, that light can easily be able to penetrate the skin. At the moment, using the finger as a major picking point for variation in the light intensity, and in case there's any interference with that, we would be able to pick it. But at the same time, we do use the magnets. The magnets help us to orient these infected cells, since when a cell is infected with malaria, there's a substance that's excreted, which we do look out for.
However, the team realized the need to have this improved to cater for health facilities that receive many people.
Such that if people went to this normal process of diagnosis, they can also be tested at the hospital using a same device that can be stationed there.
The socio-economic impact of malaria includes out-of-pocket expenditure for consultation fees, drugs, transport and subsistence at a distant health facility. Matibabu malaria kit is now ready for clinical trials, according to the team.
We did a need-finding survey also with this, and we found out that people were actually willing to use the technology.
We have done a few control tests, that's how we call them, in different labs. We did some when we were in Germany. Right now we're preparing to go out and start clinical trials soon, but we're still going through the ethical approval process to get there.
The team recently won a Royal Academy of Engineering's Africa Prize in London for their innovation. But they say international recognition comes with tasks and expectations, especially related to ownership of the idea.
Know that we can eventually maybe be able to detect sickle cells, anything that affects the biochemical composition of the red blood cells. We can easily venture into it and see how critical we can be able to detect or identify it.
We already have a patent that covers Africa, and that's Uganda as well. It also covers some parts of Asia and South America. But also that we also have taken in mind that even people who are not just in those affected countries would also pick the idea just to make money off it.
The Matibabu team have encountered a number of challenges, including inadequate availability of parts to manufacture the kit.
That's why we had to move outside to look for somebody to help us in the development. At the moment, we do not have parts manufactured here. But I think with time, because most of the things that are here in Uganda, most of the raw materials, people get them in Japan, China. With research and development and prototyping, so far we are around 100,000 plus US dollars. Yeah, so it hasn't been an easy journey.
However, once it's approved, the team has also set a price at which a health facility can acquire the kit.
We estimate between $100 and $250 for a kit. And for the health centers that cannot afford, we are designing a leasing model where we can give them the device for free, and we let them do the diagnosis, and then we share the revenues after it's done.
Dr. Jimmy Opigo, the manager of the National Malaria Control Program, appreciated the innovation and pledged support for the team.
Ideas, if not supported, cannot get funding to operationalize. It's so difficult to operationalize because the thing has to be manufactured on a commercial basis, and then it has to go into policy. So the next support we shall give is for us to change the testing models to include this device, to put it, and then to also recommend it to the rest of the country, that the rest of the world, that this is the way to go.
Uganda has the 6th highest number of annual deaths from malaria in Africa, as well as some of the highest reported malaria transmission rates in the world, with approximately 16 million cases reported in 2013 and over 10,500 deaths annually. In addition, malaria has an indirect impact on the economy and development in general, but with such innovations, the incidence and impact of malaria can be reduced significantly. Walter Mwesije, NTV.